Hi and welcome back. Now, if you're not getting enough of the right type of fat in your diet, this can cause you a number of problems. Problems such as hair loss, a weakened immune system, but also, more importantly, deficiencies in vitamins. Now, one of the vitamins that it's been found to affect is vitamin K2. A lack of vitamin K2 can cause two problems. It can cause calcification of your arteries, but it can also cause osteopenia. And osteopenia is where the protein and mineral content of your bones is reduced, but not to such a degree as osteoporosis. The type of fats that you should be eating are monounsaturated fats and polyunsaturated fats. And typically these types of fats are found in avocados, fish, nuts and olive oil. So as long as you include all of those in your diet, then you should be taking enough fat content to make sure that you don't have vitamin deficiencies, and in particular the deficiency of vitamin K2. And now I'm going to share a couple of video clips for you from Dr. Jamnadas, who is a cardiovascular surgeon, where he discusses the deficiencies of vitamin K2 and how this affects your body and how it's as a result of low-fat diets.
There's something else that's got to do with calcium metabolism. And today I'm going to tell you that the answer is probably vitamin K2. What is vitamin K2? Vitamin K2 is a fat-soluble, it's a fat-soluble vitamin. That means you cannot absorb it into your body unless there's some fats available. And vitamin K2, assume for now that it's got something to do with good bone metabolism, that you need vitamin K2 for strong bones. So what's going to happen if you take vitamin K2 away from your body is you're going to get bone disease. Why would you get rid of vitamin K2? Why do we have vitamin K2 deficiency? Why would I even think anyone's got vitamin K2 deficiency? That you get vitamin K2 deficiency because of the lifestyle changes we've made. Because it's a fat soluble, and now we're on a low-fat diet. Because with it came vitamin A, D, E, and K deficiencies. With these vitamins, you just need small amounts in your bloodstream to have a tremendous effect. And when we go on these odd diets, such as all these low-fat diets, you're not going to absorb those vitamins. And that's exactly what we've been finding. So these matrix GLA proteins, what are they doing in the tissues and where are they being produced? They're produced by the smooth muscle cells of the blood vessels. So the blood vessels, they have smooth muscle cells. That's where they can vasodilate and vasoconstrict. They make this protein. This protein has to be activated by vitamin K2. When it's activated, it'll bind calcium and move it out of the blood vessel. When vitamin K2 is not there, there's nothing to take the calcium out of the blood vessel. When the vitamin K2 is not there for the bone will not be able to mineralize because that particular protein in the bone binds to hydroxyapatite and then the calcium gets trapped in the bone. So you would expect that vitamin K2 deficiency is going to cause calcification in the tissues, the blood vessels, and causes demineralization of bones. So it causes osteopenia, and that's exactly what we've been seeing. You get more degenerative joint disease, more osteopenia, and more calcification where you shouldn't find calcification. Blood vessels should not be becoming ossified. So what's happening is that the total body calcium is actually pretty good, but it's all in the wrong places.
Interesting stuff, isn't it? And it may be that you've reduced your fat intake to lose weight. And there's far better ways to lose weight than actually reducing your fat content. But more importantly, if you are going to reduce your fat, make sure that you have the good fats, like eating avocados, olive oil, and nuts. Because that way that you're going to get the fats and you'll make sure that you can absorb vitamins like vitamin K2. Now, instead of cutting down on fat, what I'm doing to lose weight is to do intermittent fasting. Now, I didn't start to do intermittent fasting to lose weight, although that has happened to me. I've lost over a stone in weight now, which is more than 14 pounds. I started to intermittent fast for all the other amazing benefits that you get as a result of the extended fast between when you last eat and when you eat again. Effectively, what I'm doing is missing a meal. And the intermittent fasting regime I'm doing is the 16-8, which means that I fast for 16 hours and I eat during an 8-hour window. So I urge you to have a look at doing intermittent fasting like I am. But before you do, and certainly if you've got diabetes or any other type of medical disease or you're on medication, speak with your doctor first. Now, I'm not a doctor, I'm just a guy on the internet, but I'm very much benefiting from doing intermittent fasting. So thank you very much for listening. Have a great week. Bye for now, and I'll see you on the next video.